motherhood is so valuable for our own children and families, but also for the wider community. And if we can support mums to have a really good start when they become mums and with their babies, I think we could solve so much down the track.
Welcome to Pregnancy, Birth and Beyond, where stories, science, traditions and new ideas meet. Our show is coming to you from Bunjalung country, in an area also known as the Northern Rivers and Hills of New South Wales in Australia. We acknowledge that sovereignty was never ceded, and that issues surrounding country, birth, language, and culture are matters of current and vital importance to Indigenous people of these lands.
You know, we all think we're making the right decisions. We all want to make the right decisions. And so to find that the system actually isn't necessarily always working in our benefit enrages me.
Annalie Attia with you today, and in this episode I'm speaking with Mother and Maternity Services Advocate and Representative Helena Mooney. Helena is co-founder of Friends of the Northern Beaches Maternity Services. Along with other local mums, midwives and doulas, she championed for several years to protect public maternity services at the new privately run public-private Northern Beaches Hospital. Amongst other things, the group focused on ensuring midwifery group practice was preserved and ideally expanded to become available for more women on Sydney's northern beaches. It was a long campaign which resulted in being invited to present at the New South Wales State Parliament's inquiry into the management and operation of the new hospital. Helena is a parenting coach focused on helping parents transform everyday challenges with connection and play. You can find out more about her work at parentingwithplay.com.au. Okay, welcome Helena. Thank you for joining us on the Pregnancy, Birth and Beyond show.
Thank you so much for having me.
So tell us a bit about yourself. We're going to be talking about advocacy today, but I want to hear a little bit about you before we get going into that.
Yeah, sure. So I've got two children, a tween, 12-year-old and a 6-year-old. And so when I first became pregnant, I met somebody who had had a home birth and I went, oh my God, you can do that? Isn't that dangerous? And so learning about birth led me down initially to have midwife group practice and a water birth in a hospital, and then to have a home birth with my son. And opening up to the amazingness of birth and how important birth is for us as mothers as well as for our babies. And then I also became very passionate and interested in about parenting and how to help our children as they grow and develop. So really integrating the two has been such a big part of my life for the last 12 years.
Amazing. And I know you work with families. You're a parenting instructor. Can you say a little bit about that work?
Yeah, sure. So initially I trained as a doula. So I really was passionate about birth and trained and helped supported parents then. And then I thought I want to do more as well beyond. So I trained as an aware parenting coach instructor and through Hand in Hand as a parenting by connection instructor. So I work with families from babies all the way through to tweens, helping them with their children's emotions and helping parents with their emotions so that they can then best support their children, and bringing a real playful element to parenting rather than making it all serious all the time. But talking to parents then, birth is a key part of that. So, you know, often when I'm working with parents of babies, I often ask the mum, well, how was the birth for you? Because birth isn't just a 24-hour period as people often describe it. It has lifelong effects. So I'm really passionate about supporting parents through the birth and with their kids as they grow up.
That's so beautiful. And so, I mean, I can hear you're so passionate and that these topics are so important to you, but how exactly did you get into advocacy, into maternity health consumer advocacy?
Yeah, who'd have thought in the beginning? Well, to begin with, the woman I knew who had a home birth, she introduced me to Home Birth Access Sydney, as it was called at the time. So I went along to pretty much every monthly meeting that they had just to learn more and more about birth. And even though I didn't go on to have a home birth, I then just became passionate about birth as a whole. So joined their committee and ran some of their events there and just trying to do whatever I could with the very little knowledge that I had at the time. And on Emily's first birthday was the rally in Canberra, so we went to that, and that felt really good. And then wasn't really sure what more to do particularly. And then I had my own struggles in getting pregnant with my second child, so I stepped away from being a doula and getting involved in birth because it was too hard at the time. But then when I had my son, and he was a home birth at home, and I'm in Sydney's Northern Beaches, and my amazing midwife, Cheryl Sidery, she pointed out at the time we were going to have a new hospital being built, the Northern Beaches Hospital. And it's a public-private partnership, which means it's a privately run hospital having a public maternity system and a private maternity system. And it wasn't until she pointed out to me the ramifications that a private company running public maternity services could have on the provision of public maternity services that I finally twigged what all the fuss was about. And I went, oh my God, we can't let this happen. And Cheryl was working with us and sort of helping us behind the scenes. There was a couple of other mums. And that's when I really got into the advocacy on my patch, on my local area, and then having to figure everything out as we went.
Yeah, it's such a huge job, I think, for a lot of people that don't know about what maternity advocacy even is. Do you want to maybe in a nutshell, in a, like an elevator pitch, what is maternity consumer advocacy?
It's really highlighting how important women's experiences and the procedures that happen to women and their babies are in the whole birth process, which can get very lost in the complex system of running a hospital. And so, you can focus on how things are run, but often the women's experience can get lost. And one of the things I've really encountered is people then belittling the women's experience, going, well, we just have to look at, at least women and babies are not dying so much. But birth is the start of motherhood, for that child or subsequent children. This is much longer than an elevator pitch, sorry. And the importance for the baby, obviously. And there are different modalities and different ways of looking at maternity, provisions of maternity services. And when it's taken at a very clinical level, the woman and baby's experience gets missed. And when women are treated well, they have better outcomes. They have better experiences and they have better outcomes for them and their babies. So a woman's experience is absolutely vital and should be placed at the center of the care. And sometimes it gets a bit lost. So as an advocate, as a consumer advocate, we bring that to the table, because even working with amazing midwives, they've been working for years, seen lots of women, and often they can also get caught up in the system. Whereas we bring a fresh pair of eyes to what's important, as well as their clinical expertise, obviously.
Yeah, to what's important to the consumer, which is in Australia we call a health consumer, the person who's accessing the healthcare service. And I mean, this is a very big thing. There's health consumers across every sector and every aspect of healthcare, not just maternity healthcare. And oftentimes maternity healthcare kind of is left to the end of the list of even within health consumer advocacy. It kind of gets put to the side, which is ironic in a way, because all life starts at birth, and the health and well-being of that child and is intricately related to the health and well-being of its mother, and both of their experiences within the maternity healthcare system throughout pregnancy, the birth itself, and the postnatal care are deeply impactful. Health, whether that's mental, emotional, physical health in all those realms for that family, for that unit, for those people, for their life to come. And so it's funny how we kind of relegate maternity care to the side, while actually it's kind of the seed in the soil of the work that we do in healthcare.
It absolutely is. And really the baseline is, does the mother and child survive? If you're both still alive after this process, well, then what have you got to complain about? Yes. Whereas exactly what you're saying, it's such an integral part. And I remember going to one birth conference and somebody describing it to me, and that really twigged, is our role as, birth professionals or birth advocates, or those supporting women and families during birth, is to look after the mother, so that the mother can then care for the baby. Whereas what often happens is the mother's bypassed and all the attention's put on the baby. But if we can really nurture mothers and that family unit, they can support and care for their baby perfectly well. But they need good support. And that's what we advocate for.
Yeah, beautiful. That's so beautiful. So maybe give us a couple of examples of the advocacy work that you've been involved with over the years. And actually, how many years has it been since you kind of started advocacy?
Well, working with Home Birth Access Sydney, that would be like 11 years ago. But really, for what I was doing with the Northern Beaches Hospital was from, my son was born in 2014. So pretty much from then to sort of to date, really. And do you want to know about the process? Oh, and also now with what's great is that I've learned so much by working on the Northern Beaches Hospital. And even though it's quite a unique experience because it's a public-private partnership, and the Liberal government was going to roll that out across the state, and that has now been stopped because it hasn't met with great reception from the local communities, and it's actually a really difficult model to run. But through that process, I've then learnt so much. And now I'm part of a maternity services alliance with professional organisations such as the College of Midwives, the Nurses Midwives Association of New South Wales, those organisations that we're seeing the benefit that we really need to work together. Because what often happens in advocacy is we work on our little fires and try and sort of put them out or create change in our local areas. But actually, if we could all really work together, we'd be a very powerful force and be really cohesive in what we're trying to achieve. And we'd be heard better and have better receptions and hopefully better outcomes. So I'm really excited to be part of that at the moment too.
Yeah, that sounds super exciting. I mean, absolutely agree with you that when, because there's so many, I mean, let's talk a little bit about an example of what it looks like to be a maternity consumer advocate. It's often you're kind of working in your silo and you are getting support from other organizations, but it can be quite demanding in terms of how it feels like you're out there kind of often what it feels like alone and not having as much support. So the idea of an alliance is just exciting and wonderful, and I think that's so wonderful. But tell us maybe a little bit more about your experience with the Northern Beaches Hospital, and what did that look like? What did the advocacy there, if you can, again, in a kind of...
Well, initially it was finding fellow people to work with, and luckily our midwife put us in touch with various other mums. But a lot of the time it was like 2 of us, 3 of us. It was quite a hard slog. And initially, to begin with, is to understand all the terminology and who we need to contact. And with the case of Northern Beaches Hospital, normally in New South Wales, you approach your local health district who then runs all the hospitals. But because this was outside of the normal realm of hospital management, because it's being run by a private company, there was extra challenges there and knowing who to contact. But what we did is we started off with the local health district, and the thing is that myself and Kelly Ponsford, who we were doing the initial work together and going into meetings, we really didn't know what we were talking about all the time. We knew what we wanted, and so it was quite hard, I think, sometimes to be clear about what we wanted, because we didn't really know. We were just sort of going in there going, well, our key aim was to protect the public provision of maternity services, and in particular was midwife group practice, which is not provided by private hospitals. So we were really clear that was our goal.
And maybe just stop here and extrapolate what midwife group practice is. That's continuity of care with a midwife?
Yes, with a known midwife.
So what does that look like for the person accessing the care in a single liner?
Well, you have either one or a small team of like 4 midwives that support you throughout your pregnancy, throughout birth, and in that immediate postnatal period. Whereas the normal provision of services through a public hospital is you could meet whichever midwife happens to be scheduled on that day to do your appointments or to be at the birth and then postnatally. So
most women in Australia, and for numbers so people get context, about only somewhere between 8 and 10% of women are receiving continuity of care throughout their entire pregnancy from a midwife. But the majority of people who access maternity healthcare services, they would just rock up at the hospital and see whoever's rostered on for that day throughout their entire pregnancy. So that might mean that they need to tell their story every
multiple
single time.
times. Yeah.
You know, and of course we've got the guru, the clipboard, but the clipboard is not a human being and doesn't have a memory, and not everything's written on it properly, etc. So the person often who's accessing healthcare often needs to come and tell their story or parts of it again and again and again to each time they meet the new care provider in that moment, who doesn't have a lot of time for them, has to write stuff down as they're doing it. So it's not necessarily building up a relationship with them, etc. So that's the common care that women receive, and families and people who access maternity healthcare services are receiving throughout, while as what you were advocating for was the provision of midwifery group practice, which means that the person who is accessing maternity healthcare services at that particular location is receiving healthcare services from the same small to medium team throughout the entire pregnancy, the birth itself, and postnatally, which means that they would receive continuity of care. No matter what other care providers they would see, but they would still see that same small team for the majority of their antenatal needs, including the birth. And if they needed an obstetrician or whatever other care provider, that would be provided within the care. But is that
yes, correct? Although then the problem with MGP is that it's only offered to a very small number of women, and then there's often strict criteria around who can actually access that. So for what we were doing, it has to be low risk. And yet it's a travesty, because it's very clear, the research is very clear, that women and babies have better outcomes when they're looked after by a known midwife throughout that time. Regardless of risk, absolutely. And, you know, there's often the buzzwords about trauma-informed care, that they, you know, people who have had traumatic backgrounds can get the best type of care, and that's care by a known midwife throughout. So if we could offer all women access to this type of care, we would see lower rates of intervention, unnecessary interventions, and high and better outcomes for women and babies. And so by the advocacy that me getting involved with the Northern Beaches Hospital, initially we were just trying to preserve what was currently available at Manly and Mona Vale, although it's only available at Manly, and then from there then realizing, well, why can't all women have access to this type of care? And so then, you know, even though I initially started off as being very sort of hospital specific on the Northern Beaches, it was like, well, this is a broader issue throughout Australia and actually throughout the developed world of maternity care. If all women had access to a known midwife, we'd be in a much better state.
Mm-hmm. Amazing. And so your focus with the Northern Beaches at that particular time was around ensuring that the publicly funded aspect, or the public services at that particular hospital, involved having MGP as well as other services. Is that what you were trying to preserve there?
Yes. Absolutely. Also, the other issue that we had was water births. This is a brand new hospital, so they're building everything from scratch. And yet out of 10 birthing suites, they only put birthing pools in 3 of them in which a woman can give birth. So we were involved even before the hospital was built. So while they were sort of setting up the plans, signing off the plans, and we were going, well, why can't we have them in every single room? Oh, no. Women don't, you know, the stats don't bear out that, you know, this is needed, because they're going on, I think in one of the hospitals there was 1 bath. So then they're going, well, at least you're getting better than what we had before. And we're going, well, great, but you've got this amazing opportunity. So they do actually have baths in all 10 rooms, but only 3 in which you can give birth in. In the other ones, you can labour in them, but if, you know, as soon as baby starts to come out, you've got to get out of that bath. Well, that just seems such a ludicrous
room you want to be in. That is ludicrous. That's absurd. So you'd have to learn advance if you want to labour and birth in the bath. While as I think that's often something that happens. Some people know in advance, but sometimes they don't. And so
another part of what we needed to advocate for was that those 3 birthing pools were only going to be kept aside for public patients, because there was the risk that we were starting to worry about, that private patients would go, well, we want to have a water birth too, which normally Hellscope doesn't allow in any of their hospitals. So even though we don't want to deny women access to it, we had to really put a ring fence around that, going, no, that's available for public women. And with the statement that we would prefer all women to have access to it. But if they're choosing to only build a hospital with only access to 3 rooms, then that needs to be preserved for public women, which they've said that is.
So, and is that hospital now built?
Oh yeah, it's been built and it's been running. Actually, it's coming up for its 2-year anniversary. So we met with Hellscope a couple of times and raised our issues there. And what was great is that we had mentorship by some amazing women, one of whom was Sally Cusack from your fabulous organization, and also another woman, Natasha Donnelly, they've both got real experience. One as a consumer, one started off as a consumer and then works within the system now and is doing amazing research work. So without those two women in particular, as well as the midwives who were supporting us on a local level, we wouldn't have known what to ask for or how to counter the arguments that come back. So getting mentorship and reaching out to somebody who has done this before and understands the system better is absolutely key to knowing what to ask for and who to go and what to do in those moments.
And less wasting your time, because often as a consumer advocate, you're spending a lot of time trying to figure out all these different things. And if you've got some extra support, it's so helpful. And I think we're all our organizations, Maternity Choices, Maternity Consumer Network, Pregnancy, Birth and Beyond, in the SAM advocacy work that we do, this is part of the work that we're all trying to do, including this interview today, is giving more context and understanding as to what the work looks like, etc., and what the challenges are. So these are really important conversations as well. But for sure, for people to seek out extra support if they're doing work and try and connect with the established organizations in this area, but also just individually with health consumers that have been working in their area and doing this work. And so that's been really, really great to hear about that. And so what were the outcomes in terms of just on the Northern Beaches Hospital? I know that it ended up going into an inquiry, a state-based inquiry. So can you tell a little bit about that bit?
Well, initially, because it felt like, we were banging our head against a brick wall most of the time.
Their response from the hospital wasn't very...
no, they weren't willing. They weren't interested.
In anything because... Was there anything that they were coming towards you with as consumer advocates and consumer representatives?
Well, we met with Brad Hazard, who's currently and was then the New South Wales Health Minister, and the hospital's in his electorate, so we had quite relatively easy access to him, and he said that he got us an extra bath. So apparently it was 2 baths to begin with, and then he managed to get an extra 3rd bath. In terms of, so that was good, or to some extent.
Yeah.
In terms of Hellscope, they weren't that willing to engage. They did meet with us, but I think they did that just because they felt they had to. But there was nothing that we asked for that came out from it.
Mm-hmm. And also to be clear here, for people perhaps having this question, well, do they have to meet with you? There is the Australian National Healthcare and Quality Standards. I can't remember exactly what the thing is, but it's improving the quality and safety of healthcare services in Australia. That's what these standards exist for. And there's 8 standards. The second most important standard is partnering with consumers. So partnering with consumers in order to improve the health and safety of healthcare, that has been shown in all research from all over the world, from all different areas of healthcare. It has been shown that when consumers are involved in from the design, so from early days before they've even put the design on paper, from the design all the way through to, of course, working stuff out, the implementation, and post to reviewing services, when consumers are involved in all of those stages, the healthcare service is going to be better. So you are at the perfect opportunity to be consulted with and to be engaged with by this health service, Hellscope, that is providing the health service, Hellscope. Yet here you are showing up to engage with them and to provide feedback from the community about what's important to the community, for the community, when it comes to maternity healthcare services. And they were saying, we don't want to hear from you. They didn't
want to hear from us.
Yeah.
And they said that they had they had engagement with 2 consumers on one of their committees. And we were going, well, that's great. Who are they?
Yeah.
Sorry?
And they didn't want to tell you who they were.
We asked for going on 2 years. We're saying, who are they? They saying, we can't give you their contact details from, privacy data issues. So okay, well, can they contact us? And we asked the hospital, we asked the local health district. I think we even raised it. We definitely raised it with Brad Hazard, and nobody told us who they were. We did subsequently find out that they were two actual members of staff, one of whom had had a cesarean birth and one of them had had a natural birth.
Wow.
And that was it. And we're going, well, this is not true consumer recommendation.
Yeah, that's not a consumer advocate, and that is well reported. No. Yeah. So
we're very cross about that.
Yeah, to say the least.
To say the least.
To say the least. So yes, that's a great example of my next question to you was going to be about the challenges, and that's a great example with the tokenistic engagement that a lot of health services, they think, okay, we have to engage, so we'll just employ somebody, we'll just get somebody from staff to do that, and that's not at all. That would not be considered in any realm to be. That's a massive conflict of interest, number one, but also.
But they could tick it off going, we have had consumer engagement, so it was very tokenistic.
If there was somebody overseeing these things properly, then they could never tick that off. But that's one of the biggest challenges in consumer advocacy, and in meaningfully applying standard 2 is that there's no overseeing governance that looks to see how well is consumer advocacy and consumer engagement being implemented in any particular service. There's more and more. I know New South Wales Health is doing an okay job and better job every day at doing meaningful advocacy, engagement with consumers. But yeah, it needs a lot of work, and there's no accountability officer or accountability partner.
No, and the issue that we had was because it's a private company, so. First of all, private maternity services is highly profitable. Mm-hmm. So that was going to be their main focus. They wanted to get as many women to go through the private side of it rather than dealing that much with the public side. Yeah. So that was a big challenge that we had. But I do think that, and we've been told that, because of our continued presence and pushing for it, the MGP was maintained there. The numbers are low, but at least they kept it going. So that was something that we felt pleased with. But hang on, I've lost what we were talking about now. What were you talking about?
We were talking about the challenges, but I'd like
the challenges,
to talk
yes.
about the state inquiry just before we move on to that next question, because I think that was an important part of the achievement of that advocacy work, that you pushed for a state inquiry. How did that come about with the state?
We partnered up. So there was a very active community group called Save Mona Vale Hospital, because where they're located, the new hospital is quite a long way from their locality. So they were hugely active, and they were great, and they ran a lot of rallies, and they invited us to speak at them, and that was brilliant. So we worked really well with them, and that helped raise the profile, because the problem, one of the big challenges, I'll come into that in a minute, but is that people don't understand how the maternity system works. So by us working with them, we could increase that understanding in the community about the actual implications of this new hospital. But as a result there was a lot of disasters when the hospital first opened, hugely negative press coverage. So it was absolutely on the radar that there was something going on here, and particularly because it was a public-private partnership, which had happened in other places, Port Macquarie, which didn't work, but this was a very high-profile one. So as a result of all of those issues, it turned into a state inquiry with the New South Wales government. So they put out for submissions, and our team put forward a submission. And then as a result of that, we were then invited to actually present at the inquiry. So I went along and read out an initial statement and then answered some questions there. And when I was talking, because of reading the statement, I just really wanted them to understand that there's a difference in type of services that women receive between private hospitals and public hospitals. And I could see the penny dropping as I was saying it, so that they could actually really understand the impact. It wasn't just, we're against privately run hospitals. We were very much about, this is the reason why we're against privately run public hospitals, and this is why it's important to protect public maternity services in this hospital. So we were really pleased. What happened is that we asked for 35% of women to have access to MGP, which was the towards normal birth recommendation, which was, I can't remember when towards normal birth came out, but that was
2010, not long. Yeah, I think it was 2010. Not long after the National Maternity Healthcare Services
Right. So that was the recommendation, but I mean, it's not being followed anywhere, I don't think. So
no,
it's like, I think it was 11% on the Northern Beaches we had. So we were saying at the very least, we'd like 35% of women to be able to access it. Anyway, they then came back with their recommendations just before COVID lockdown, and their recommendation was for all women to have access to MGP, which just felt so amazing, because an outsider can see, well, if that's a way of supporting women that has better outcomes for women and babies, why aren't all women offered this? Anyway, the response has come out recently from New South Wales Health, and they're going to look at what they're going to apparently have community engagement and look at what the requirements are from the local community, which is basically a cop-out that it's not going to be offered to all women.
You're listening to mother and advocate Helena Mooney on the Pregnancy, Birth and Beyond show. Now that New South Wales Health has responded, you're seeing that it's relatively tokenistic, and so that's the next kind of thing to work on.
That's the next thing to work on. But I think it's interesting that they're saying that they're setting up these community engagement groups, and yet we, as the only maternity services advocacy group, have not been contacted to be part of that. So even at the next level, and we're not being aggressive, we're not being horrible and difficult people to deal with, but we still, we've been saying we need to be heard. You need to listen to us. And this is what the women of the local Northern Beaches, it's important that one of the big challenges, I will say now, is that women don't understand the maternity system before they go into it. So what came back to us a lot of the time was, well, there's no wait list for MGP. So that means that there's not the demand for MGP. Therefore, there's no reason for us to expand it. And our argument, and now they're going to say is, they're going to see what the community requirements are. But the problem is if women don't know about that A, MGP exists in the first place, and B, the actual real benefits to them, then they're not going to ask for it. So why are hospitals only waiting for consumers to ask for something which is known to be the best practice? This should be offered to all women. And if a woman chooses not to have that, then they have the opportunity to make the choice to do something else. But why are we not providing it to all women regardless? So to place the emphasis on just the consumers asking for it, which when you're newly pregnant, if it's your first baby, you've got no idea really what's happening. You're just excited you're pregnant, or maybe a bit overwhelmed. It's generally a silent time that you don't tell your friends in case you miscarry. So how do you find out sufficient information about making a good decision? So if there's something that is not well known, then you're not going to know to ask for it. And the problem with MGP is that those who are in the know get in quickly, and then all the spaces are gone. So that is a broader issue with the problem with MGP.
Hospital, if you don't call pretty much the day you find out that you're pregnant, which is 6-7 weeks, then you miss it. You miss out on being able to receive that care, and then you're shipped up to Tweed Heads Hospital, which at the moment, most women who go there, they just get whatever the luck of the draw basically on the day, and then not only are you going further away from your community, you're getting a lesser model of care on top of that, and as we know, being pregnant, the further away you need to drive or get to, the more difficult it becomes as the pregnancy progresses, and especially during the birth and postnatally. You want to be able to have those services nearby where you live for them to be meaningful and supportive. And as mentioned before, the within the context of a lifelong health and well-being for that the unit, the baby, the mother, the family unit, and the whole community being the seed in the soil, it's so critical to get it right at the beginning. It's just unbelievable that it's not seen so in that way. But also it is believable because a lot of times this is the realm of mothers and motherhood and women, and oftentimes it's an unseen realm, and it's just expected, and it's just get on with it and deal with it, and nobody talks about it.
And if you're all alive, what are you complaining about?
What are you complaining about? Well,
and also the problem also with MGP is that it is those who are in the know, which is generally affluent middle-class women, which is great, and they should have the care. But, a load of women are missing out who really could benefit from this form of care. So
everyone could benefit, no matter what
everyone.
Risk. And no matter what, especially, and in fact, you could argue quite easily that the more risk you have, the more well off,
the more you need it.
And risk as in that's physiological risk in terms of maybe the pregnancy BMI or this or that or something going wrong with the pregnancy, but also risk when we're talking about low socioeconomic, when we're talking about women in domestic violence situations, when we're talking about
women who experience sexual abuse,
any kind of other risks involved, like the social determinants of health. When you have continuity of care, relationship-based care throughout the pregnancy, you're more likely to deal with a lot of the issues that come up for those people during that time and make it worse for them. And so you have a great opportunity to support families at that seed and soil level who are in a lesser situation when you provide continuity of care. So it really boggles the mind that that's just not the basic care that is provided during maternity care for every single Australian woman, no matter where she lives. It just boggles the mind. It's also a cheaper option, because when you provide continuity of care, in the bigger picture, eventually the dollars get down and down because there's less necessary interventions with this care. It's been proven. So the less interventions, the less cost there is for the system. So it's really a very interesting dynamic. It just goes to show that it's not really about evidence and research. It's more about culture and beliefs and attitudes.
And there's a dichotomy between the private model, the private obstetric model, and the public midwife model. And one of our key worries at this hospital was that Hellscope wouldn't see it in their interest to provide extensive MGP access through the public system, because then women would go, well, I'll have that, thanks, rather than choosing to pay for private care. So we were very worried that they would just sort of not run down the public, or just provide the absolute basic, not do what you would do if you had a conscience. Basically provide it to every single person. Well, because it's bottom line financially
attached to a bottom line. So do you know with that hospital kind of where they're at the moment, are they providing a mix of public and private?
They absolutely are, and they do still have an MGP practice, which is good. It's just not very extensive. And this is also what we really wanted to emphasize in the inquiry, was that our complaints were never about the individual midwives, the staff there. It was about the system within which they were operating, because and this is the thing, for midwives in particular, we're their biggest advocates, and we're there to support them so that they can do the job that they trained to and want to do. The system is the problem. And so the midwives who are working at Northern Beaches hospitals are doing a brilliant job. We just object to the system.
Yeah, fair enough. Well, okay, enough about that, because we could go on all day talking about that. So I guess we did kind of touch on the challenges. Is there anything else, is there anything else that comes up when I say what are the challenges in maternity advocacy that we haven't touched on?
Yeah, it's so big. To begin with is understanding who you're meant to talk to, how it fits in. And I was going, well, of course they're not going to want to have consumer engagement, because we're just going to ask for things that they, it's too hard for them to give. So then really understanding that standard 2 is a requirement, but also leads to better health outcomes for everybody going through the health system, so that it's in their interest to engage with consumers. Also, as I said earlier, about women understanding the maternity system and understanding how powerful MGP is and the benefits to MGP, because that information is not out there. So I think that that's one of the biggest barriers to effecting change, is because women don't understand. And initially people go, oh, well, private care, I'm paying for it, well, I'll have that, thanks very much. And for some women that's brilliant. But the saddest thing that I have, or when I hear women say, I didn't know that if I was going to go into a private hospital, my chances of having an intervention increases by 20%. I didn't know. And that for me is the saddest thing. And I just wish that more women did know in advance of pregnancy, that when they do become pregnant, they can make better decisions. Another challenge was our time. We all had little babies and little kids, and we're doing this for free. And so we're juggling motherhood and work, and, it can be really time consuming. But what was great by the end, when we were 2 years ago, when we were really ramping up, is that we then got quite a good team. And so we were divvying up the jobs, and that felt really cohesive. But this Northern Beaches, it's taken years. And so it's a long time to sort of keep persevering. So we would come, I'd sometimes do loads, and then I'd go, oh God, this is too hard, I just need a break. And so we'd sort of come in and out, and do what we could manage when we could manage it. And having that team really has helped. And another challenge was we'd post in the local communities, and we'd have coverage in the Manly Daily. And then a lot of the feedback would be, well, you should just be grateful you're getting excellent public care in any case, and that, your baby's still alive. And so there was that sort of, I think, the perception in the community that we were just sort of, just almost being spoilt about it, that we just want the best care, and how dare we keep asking for the best care, whereas explaining that actually the type of care that we're asking for is a cost-saving model in the long run, rather than we just kept asking for more and more expensive machines. We were saying, we're not asking for more expensive machines, we're asking for a bath. We're asking for basic stuff here. This is not, loads of different machines and expensive things. We're asking for basic care, which is ultimately better for women, better for the environment, the community, and saves the New South Wales Health and Local Health District money in the long run. So there's a lot of challenges from an external, and as well as, from our own family dynamics too. Is my husband was like, are you still working on that? I'm going, yes, I have to. I can't stop.
That's it. I mean, that's such a common thing that I hear. So this actually brings me to the next question, which is, I mean, dear God, dear Lord, Helena, why did you keep doing this work? In a voluntary capacity, hardly ever being paid for it. You're often, health consumer advocates and health consumer representatives are often the only person sitting at the table that are not receiving any remuneration for their time, not being paid to do the job. You're working in a voluntary capacity without being paid. It's challenges uphill the whole way. You always face a no, which you have to say, no, this is really important. Can you please listen to me again and again and again? You're often not receiving the outcomes that you like or want to, or why you went in to begin with. There's rarely it's actually met with a positive, full yes. And you're often alone in it. And there's a huge load. And often, more often than not, most of the women and the people in maternity healthcare advocacy are often mothers with young children, which makes it very, very complex and difficult in terms of consistency, capacity, and time and all of that. And on top of that, you're learning the jargon and the language and the information of several areas that you've never been involved with before, through the hospital language, the local health district language, the New South Wales health language, understanding research. You have to read heaps and heaps of papers nonstop. And so you're putting all this time and energy to understand one small thing, to ask for a bath. Dear Lord, why did you keep doing it? To be clear that I'm asking you this question not because I don't know the answer, but I want the listeners who often don't understand the level of dedication and love and care that's been put into these roles, and they can't imagine, why would anybody do this, especially the healthcare providers that are sitting in the room with you. They're like, well, why are you here if it's so difficult? What is it that drives you to do this work, Helena?
Oh, I'm tearing up even just thinking about why, because it's so important. Motherhood is so valuable for our own children and families, but also for the wider community. And if we can support mums to have a really good start when they become mums and with their babies, I think we could solve so much down the track. Women, we deserve to be supported. And like I said, I get so sad when I hear, I didn't know, when I've, a really good friend of mine, had 3 Caesars, probably unnecessarily, through the private system, because she didn't know. And she thought, we all think we're making the right decisions. We all want to make the right decisions. And so to find that the system actually isn't necessarily always working in our benefit enrages me. And I'm so passionate about birth. I know how transformative it was for me with both of my babies. And I tear up when I hear a really good birth story. I just think that's so beautiful. And then when it's a sad birth story, a really hard, traumatic birth story, again, that's just such a hard thing to hear. And I want women to feel really supported. And I ended up having a home birth, and I had a home birth for my IVF baby. My second baby was IVF, and I had a home birth. And it was one of the most empowering, amazing things I've done. And I know that I had 2 really good births because I had fantastic support. And if we could give all women fantastic support, oh, it's life-changing. It's life-changing for women. It's life-changing for their babies. And we need strong mothers to then care for their beautiful babies. So when I see, and I keep hearing, the system isn't working how it should be or could be working, I get very cross and very passionate. And I just think it's so important. And also because, I support parents now, and they may have tweens now. And, sometimes if you ask them, how was your birth? Some start tearing up straight away. So our birth how we birth stays with us for the rest of our lives. It's such an important time in our lives.
Yeah. Thank you, Helena. And to finish off, I want to touch a little bit on the bigger picture. I mean, being part of the changing narrative rather than take it in all on yourself, which I think a lot of times consumer advocates go into this going, there's so much to change, and you feel so passionate, like you could just change this one thing. And then they realize that there's been people, mostly women, it has to be said, I've come across a couple of men, but in the whole time it's been 99% women, 95%, let's say that, doing this maternity advocacy work that have been in it for decades, trying to advocate for the same exact thing. So I'm working today with women who have been working for 4 decades for women in Australia to have publicly funded home birth programs within their health services. And we know that so far that's been worked on for 40 years. We've got it in 17 hospitals across Australia. That's it. That's where you can get publicly funded home birth. And that, to receive that publicly funded home birth, as we know, you need to call in the moment you are pregnant, which means you need to know that thing exists and that it's safe and that there's an option for you to have that. And then you need to hope and pray to God every single day that first you have to fit a very narrow criteria, and then once you're in, you have to keep praying that you don't get risked out. Because which happens to a lot, which I think is almost worse than not getting in at all, because you get that great care for a few months and then you get risked out to non-care, to just random care, which is heartbreaking. And we see that a lot here in our service. It's very unfortunate. I want to talk about the bigger picture and that sounded quite depressing actually.
What I was saying.
Yeah. No, what you were saying now.
It is, but
what
it
I'm
can
trying
be.
to show that change is happening slowly over time, and that we're all part of the bigger picture of change, and not to get too despondent when we're meeting with the nose or, pushing, I don't want to say the word up the hill. That's the work. It's pushing stuff up the hill, and you have to stop and rest so you don't burnt out, which unfortunately a lot of the people who work in this, who do consumer and maternity advocacy, a lot of them get burnt out after time. I speak to lots of people like that as well, and I'm absolutely have been down that pathway as well, of feeling like it's too much and everything. So how do we see ourselves as part of the bigger picture rather than just it's all on our shoulders and we have to do it all kind of thing?
Well, I love that vision that we are like a cog in this bigger machine, that we, and what we're doing in our thing will then impact what somebody else does in their area, and that we are part of this bigger picture. Because I definitely fell down in now I understand the issues. Every woman should have MGP. Right, let's change the system. And I'm feeling that responsibility. It's all down to me. Okay, and if only I could be louder or blah, blah. And that can feel overwhelming. And so I've definitely had times when I'm so active and then I pull back, because it does get really overwhelming. So to have that understanding that we each play a role in that. And you've got a great analogy about how we all contribute into the tapestry of this. And I love that too, because otherwise it can seem really overwhelming. Because say in the example of the Northern Beaches Hospital, we're working to improve things there, but it's part of a bigger system. So it's unlikely that we're going to make all the difference that we want in that particular in the hospital because of this bigger system that's going on. So to work together and to see our part in it is so crucial. And that the collaboration, and that will continue, and it will, we're just part of this bigger picture of helping to change maternity services in Australia. Do you want to do your analogy? I love your analogy as well.
Well, first of all, that was really beautiful. So thank you so much for that. And my analogy is, I mean, it's just that we're all part of the changing, there's a big weave going on, and the weave changes the pattern. The pattern is changing, and we're part of the changing pattern. So with another stitch and another stitch, each bit of work we do is another stitch and another stitch, rather than us being responsible for the whole pattern or being responsible for the actual carpet itself. It's not. We're just part of the work that's required in order to change the pattern. And that's what it feels like at the time. You feel like you're just doing one stitch, and it's, oh my God, there's so much work to do, just one stitch. But actually there's a lot of people working in this system and outside of the system and inside of the system to help make it better and change it and evolve it. And it's natural for the system to be clunky. The more you understand the system, the more you realize that in order for it to exist at all, it has to be clunky to a certain extent. It has to be heavy and slow and cumbersome and changing. So, because otherwise it wouldn't exist at all. But also it has to have change makers within it, and it has to have innovators within it, and it has to have change in order to survive. It will not survive if it doesn't change with the times. And so, there is going to be a natural polarity and natural difficulty in the work. And I think going into it with as much passion and joy to change the system, but with at the same time as much practicality and understanding that it's not all on you, and also being aware that you're likely not going to get the results you're going in to achieve. Unfortunately, I don't want to put anyone down in terms of throwing out your you're going to catch some fish, so yes, go and catch some fish, but you might not catch the big bluefin tuna the first time you go out.
But even if what you're doing, the outcome is that more women then understand, going, oh, well, I'm going to ask for MGP for my next pregnancy, or now I understand that more. You never know quite what ripples out. And I still meet people, and we were at our height 2 years ago, and I was on Facebook a lot, and I still have people going, oh, I loved what you were doing, it was so helpful to me, thank you for what you were doing. So you don't know even what the impact that you are having. And sometimes it can be like, well, if I'm not going to achieve that big thing, well, then there's no point me doing anything at all. And that's absolutely not the case, because one thing leads to another. And then, even through what I've been doing, I've met incredible women, as you said, both consumers, amazing midwives, and now being part of this Maternity Services Alliance with other midwives and a broader range. It's just extraordinary. So you never know where it's going to go either. So even though you have one objective, you go, oh, well, that, I may not have met that quite exactly, but all these other things I'm impacting or I'm getting involved with. And so then together we can work together and create this beautiful tapestry of maternity services.
Yeah. Wonderful. Thank you, Helena, so much. I've been so happy to speak with you today. I've been wanting to speak with you and do this interview for months and months and months, because I love the work that you do. I think it's so important and valuable. And I just want more people to know about this work. I know a lot of people in your community know about it, but I think it's such a valuable piece of the puzzle for people accessing maternity healthcare services, and for those providing it and those involved in the bettering of it, whether that's through research or through academia, teaching the newcomers into the system, etc. That it's really important for them to know this side of the work, which is the advocacy, which we've all been involved in, but somehow we don't do a lot of interviews about it. So I'd love to do more now that we're doing this one, and just really show this side of the picture.
And it's important to have that, because even with my mum, she's in England, she's going, well, why would the health minister want to meet you? And I'm like, well, he absolutely needs to meet me. So we can have that thing going, well, nobody's going to want to talk to me, or my voice isn't going to be heard, or we can sort of go, oh, well, I can't do anything, so I'm not going to. Whereas actually, it's actually incredible how much you can do. And then you tap into the resources like Maternity Choices Australia or Maternity Consumer Network, all these organizations and other people. We can have that groundswell if we work together and collaborate and get support from each other.
Yay! Wonderful. Thank you so much, Helena. It's a beautiful thing to finish on. So thank you for your time today. If anyone wants to get in touch with you or just learn a bit more about your work with parenting, where can they go to? Is there a website or an email?
Yes, I'm parentingwithplay.com.au, or on Facebook, Parenting with Play with Helena Mooney.
Beautiful. Thank you so much, Helena.
We hope you've enjoyed this episode of Pregnancy, Birth and Beyond. Tune in next week for more information and inspiration, bringing us full circle. You can find our show on iTunes, Spreaker, the usual social media under Pregnancy, Birth and Beyond, and our website at pbbmedia.org.